Hello, thanks for stopping by for this discussion on AARP Medicare supplement insurance plans. I'm going to discuss a variety of different topics around Medicare supplement, give you a better understanding of those. My name is Tom Basie. I've got my phone number there. I'm also available via email. And maybe if you're viewing this online, there's a link there to get in touch with me, but I'd love to chat with you further if you have further questions about this. So here we go. We're going to talk about a relationship between AARP and United Healthcare, for example. You may not understand that. Talk about different choices that you have in terms of Medicare itself, Part A and Part B that come from the government, and then these other solutions you can get from other carriers. Talk about how you can upgrade Medicare alone with a supplement plan. You can go with just Medicare from the government. It's good, but it's not great, and there's things you can do to supplement that. We'll talk about that, and then we'll talk about how you can fine tune it to something that will fit your budget. There are different pricing levels available to you. So that's what we're going to talk about today. Okay, having said that, to understand between AARP and really it's United Healthcare, notice right here, there's a co-branding, if you will. That is AARP Medicare supplement plans. You might find them and see them and be aware of them through AARP. They are administered from United Healthcare. So AARP is an organization dedicated to bettering the lives of people who are 50 and above. And then United Healthcare is somebody who's been taking care of Medicare beneficiaries for over 40 years. So there's a nice partnership they have between them. They offer these plans. Their Medicare supplements, the only Medicare supplement carrier that you get through AARP is United Healthcare for this particular solution, kind of showing the confidence they have in the AARP, in the United Healthcare solution. Okay, having said that, here's the thing. Step one is get your original Medicare from the government. There is Part A and Part B that comes from the government. Part A covers hospital stays and a little bit more than that. We'll talk about it. Part B covers stuff that's not hospital, things you get outside of the hospital, going to a doctor, preventative care, that kind of thing. You get that from the U.S. government, then you have a decision to make. You can go with option one, the traditional way, which is a Medicare supplement plan, and add a drug coverage plan to it as well, because Medicare supplement alone doesn't have drug coverage. Or you can do the Advantage plans. There's a lot of stuff in the media about that, and that is an alternative you can consider. These have only been around since around the new millennium. These have been around since the start of Medicare in the mid-60s. So you have option one or option two. I'm going to explain a little bit about both these to you so you can find the one, really, which one should you do? It's the one that works best for you, the one that you understand and feels good for you. That's the one you ought to do. So I want to help you understand that. Okay, here's a little bit more detail about Part A. Part A does cover inpatient hospital care. If you go to the hospital and you're staying there, that it covers that. Actually, if you have to go home afterwards and you got some medical care, this isn't sweeping and cleaning your house, but this is if someone needs to change your wounds or something like that. Home health care is also covered under Part A. Skilled nursing facility in between the two. If after a couple of days in the hospital, you go to skilled nursing care, that's also under Part of A. And then actually mental care, if you're in a facility for mental health. So any in care for in facility or skilled nursing or a little bit of home care, that's Part A. Part B is physician services. You get the ambulance, some testing that needs to get done, and then minor surgery that's not done in a hospital, outpatient surgery. That's Part B. A little bit more here. Hospice, by the way, is covered under Part A, and some blood transfusions covered Part A. Then some other stuff here at home. There is some outpatient mental health. You go to kind of some, just a therapy. You can do it in individual groups sometimes, and some preventative care like shots. So that's a little bit more information on Part A and Part B for you that you get from the government. Now, having said that, let's take a look at it. There's a little bit more about Part A. Here's the things that it covers, like hospitalization, day 1 through 60. It'll cover everything except for a deductible of $1,484. After day 60, it'll cover everything in there except for a $371 a day payment. I'm not going to read through this whole thing, but my message is Part A covers hospital stay, but it doesn't cover everything. So there's still a cost out of pocket for you. There's some daily cost potentially for your Part A, and there's this deductible. So Part A is nice, but it doesn't cover everything by itself. Similarly, Part B, all the stuff that you do that's outpatient, being going to the doctor, shots, that kind of thing. Well, number one, it'll cover a lot of it. It'll cover 80% of it, but you're basically going to cover 20% of that. So if during the year you never go to the hospital, but you go and you spend let's say $1,000 of health care, you're going to have a deductible of that, and then you got to pay 20% of it, the rest of that. So 20% of $1,000, it's called $1,200 to cover that. So if you spend $1,200 on outpatient alone, $203, so there's still $1,000 get paid. You have to pay for 20% of that, or $200. So again, covers a lot. It's nice, but it doesn't cover everything. So having said that, well, what can you do to cover those things that the original Medicare doesn't? You can get plans that are named with letters of the alphabet. D, think of that as in drug coverage. F plan isn't available for people who are turning 65 now, but if you were turning 65 a few years ago, before 2020, then you can still get the F. Right now, the most thorough coverage one is G. G covers almost all the stuff that I was kind of showing you that Medicare Parts A and B don't cover, except for that $203 deductible. And then the K, L, and M or other plans, they cover less than that. So I tend to lean towards a G plan, but there are varying options that we can show you and show the pricing on those. The more comprehensive the coverage, the higher the monthly premium. So these days, G is the most expensive plan that's available. It has the most thorough coverage. Okay, a couple other things to remark about that are nice for Medicare supplement. Coverage anywhere, anytime. Your coverage goes with you traveling anywhere in the US and is guaranteed to pay as long as you're paying your premium. So it is not network-based, is my point. Anywhere that takes Medicare coverage, you can use your Medicare card and then your Medicare supplement card. Low to no copays. That's the thing. It's going to cover a lot of this. So you may not have to do any of those copays that we saw. There are very few of them, or they'll be low. Okay, so it's designed to cover the copays that I showed you that does it. Any doctor, any specialist, any hospital, anywhere that accepts Medicare patients. So there's no network to you. You don't have to check and see if doctors are in network. If they take Medicare, you can use your Medicare card and then your Medicare supplement there as well. Okay, are you eligible? Well, you have to answer a yes to these. Number one, will you be enrolled in Part A and Part B when your coverage begins? You got to have Parts A and Parts B to sign up for a Medicare supplement. Are you a resident of the state where you're enrolling? If you have to be a resident of that state and enroll in that state. And then are you 65 or older, or do you already have Medicare perhaps because of either a disease, for example, or disability? As long as you have Medicare, you got to either be 65 or have Medicare early because of a disease or disability. If you say yes to all those, then you're eligible for a Medicare supplement. Okay, macro is, I remarked briefly about how F isn't available. The thing is, Plan C and Plan F are not offered to newly Medicare eligible folks. You can get that if you were 65 before January of 2020. If you turned after that, you can't get those anymore. The plans are still there and they're functioning, but they're just not letting new folks join, only people who are already eligible. There's a lot of people on those plans that have been around a long time. You can get a G plan. A G plan is close to the F. Okay, Part D. Think of D as in drugs. As I mentioned, Medicare supplements don't cover drugs, so you need a drug plan. If you have a drug plan, you're paying that carrier monthly fee, and that carrier will then get the drugs for you at lower cost. Typically, there's low copay. Sometimes a $0 copay for inexpensive drugs. You can sign up for Part D. There's a 7-month window when you first turn 65. You can sign up the month you turn 65. You can sign up to 3 months before or 3 months after. That's the initial enrollment period. So that's when you can get on there. I'm a proponent of not only getting a Medicare supplement, but getting a drug plan. Believe it or not, even if you don't take any drugs currently, because there's this penalty. They want you to have drug coverage. They don't want you to wait until you need drug coverage to get it. They'll penalize you if you do that. So I'm a proponent of signing up for maybe a very low cost plan, even if you're not taking medications, to avoid the Part D penalty. Okay, now we're going to look at a couple different options on this. Number one, these plans are stable. Okay, 1 out of every 3 Medicare beneficiaries nationwide in the U.S. enrolls in one of these plans. So they're popular, and that's because they are stable and they work well. 95% of the folks that have these report they're satisfied with it. 98% of the claims are processed in 10 days, and 95% of the people are new. So they're good plans. They're popular plans. There may be other carriers that offer these plans, but for these reasons, I like to endorse that you consider the AARP/United Healthcare supplement. What to expect: exclusive member services available at no additional costs and affordable and competitive rates. They're trusted by millions of members nationwide, and 9 out of 10 people would recommend it. There's just some more compelling remarks for why you ought to consider one of these plans. You can feel good about signing up. From a lot of people who use these. Okay, this is a chart. It's a nice illustration of what is and isn't covered by the different letter plans. So remember, A and B come from the federal government. These are the ones you could sign up for. F and C are no longer available. Remember, if you're turning 65 in 2021, for example, or later. F is no longer available. G is very close. So if you'll see, these are Part B deductible. Actually, these 2 plans actually even cover the Part B deductible. Since they're not available, we'll talk about these. And my point is, G covers these various deductibles except for Part B, for example. It doesn't cover that. And then N is quite similar to G, except you have to pay a copay here. And it doesn't have it also doesn't cover the Part B deductible. So my message is there are other plans. We can quote these plans for you. These will cost less than the G. I like the G because it's the most thorough coverage. It covers almost everything that Part F did. Part F is no longer available. You will have to pay that $203 deductible if you sign up for the G plan. And then that foreign travel, that's pretty nice. There's actually an 80% coverage on a foreign travel. So I really like the G plan for folks, but the other options are available to fit your budget. This is another nice comparison of G. That's the thing. It comes up that plan, that previous graph showed you all the different plans. This is shows you how close the G is to the C and the F that are no longer available. And again, you can get the C and the F if you turn 65 before January 1 of 2020. Okay. I don't know if I'm going to spend a lot more time on this particular chart. Based on your needs. So that's the thing. You can lower your premiums by getting one of these lower cost plans. You'll have to pay a little bit more out of pocket then. You'll have more out of pocket coverage, but these are some KL and Ns are available, and they'll have lower premiums than the G plan, for example, if you're kind of budget conscious. Okay, this shows with two different plans what happens. Alan is 71, he's a non-smoker, he's got osteoporosis, and he broke his leg when he fell out of the shower. He was in the hospital for several days. He was released to skilled nursing for additional 22 days. He also had a couple of follow-up appointments with his doctor. Now, what we're going to show you is if you have Medicare by itself, then this is what you would pay. Alan would pay, if he just had Part A and Part B, that slip and fall cost him almost $2,100. If he has an N plan, all he has to do is pay $203 deductible, and then there's 40% of some additional insurance. The G plan has more thorough coverage. It doesn't pay for that, and so it only costs $203. So this kind of shows original Medicare loan, $2,100, an N plan, $243, and a G plan, only $203. Those are a nice example of how much it costs to have, or what the out-of-pockets will be if you have just those type of coverage. Okay. F, G, K, L, and N are available in Texas. C is actually an advantage plan. This discussion is about Medicare loans. I'm not going to cover that one. Lincoln A and B come from the government. So F, G, K, L, and N are available in Texas. Okay, now this is nice. There are other carriers, like I say, that offer Medicare supplements, but they don't necessarily have this as well. In addition, in fact, Med supplement defined by the government doesn't have any dental or any vision. So United Healthcare / AARP have added some additional stuff. So there's some dental discounts and some vision discounts that are available. And then Renew Active. Renew Active allows somebody to participate. If you have Renew Active, not every gym, but there are many gyms in the country, you can actually go to that gym with no cost as a part of your Renew Active membership. So those are three things I would have you consider that make you aware of. If you sign up with AARP, United Healthcare, you get gym membership, dental discount, and vision discount, as well as all the coverage it offers to complement or supplement your Medicare coverage. In addition, there's some hearing discounts. There actually is a 24/7 nurse line available to you. There's a nice driver safety course I make available to you. And then there's something for brain health. It's kind of some electronic things that you can do online and work on to keep your brain active. So I like that, above and beyond just the coverage shown by the government of the supplemental covering the copays and the deductibles of Medicare. These plans are also available to you, or these benefits are also available to you as a part of a Medicare supplement from AARP / United Healthcare. Let's see. That's more details on those. I don't feel the need to discuss that at length. I just recognize that hearing aid, nurse line, driver safety course, mental things. There's a lot of nice benefits available that come with it. Okay. Also, as a part of this, when you sign up, if you're not already, you get membership to AARP. So you get some discounts on everyday items like groceries and repairs. You get some health and wellness discounts for pharmacies, dental and vision. We talked about that. You get a subscription to both AARP, the magazine, and the AARP bulletin, which are full of useful information for people 50 and over in the US. You get travel discounts as well, car rentals and hotels, and just important information on health, on Medicare, Social Security issues that are pertinent to people 50 and above. You'll keep abreast of the most current hot topics as a part of your AARP membership. Okay, so I'm here to help. I hope you've enjoyed this discussion. I hope I've piqued your interest on it. Please reach out to me if I can be of any assistance to you. I'd like to. Here's my name. Tom Basie. Here's both my phone number and my email address. Shoot me an email. Let's get together and talk one-on-one. I'll help you understand this more. I'll understand your situation more. And I can provide some recommendations. I'll provide a wealth of information. That's all I have for the most part this time. It's good to talk to you. I think that's all I've got to say. Please do reach out to me and let me know how I can be of assistance to you. Very good. You have a good rest of your day. Thank you.